This nursing mindset is about anti-inflammatory medications. One of the biggest mistakes people make is thinking that all anti-inflammatory medications work the same way. They don't. Although NSAIDs, aspirin, and corticosteroids all reduce inflammation, they work at different points in the inflammatory process and have different risks and nursing considerations. As nurses, we don't simply memorize medications. We ask ourselves, how does this medication work? Why was it prescribed? What should I assess before giving it? What complications should I monitor for? Let's begin with NSAIDs, or non-steroidal anti-inflammatory drugs. Examples of NSAIDs include ibuprofen and naproxen. NSAIDs work by blocking an enzyme called cyclooxygenase, or COX. Normally, the COX enzyme converts arachidonic acid into prostaglandins. Prostaglandins are responsible for many of the signs of inflammation, including pain, fever, and swelling. When NSAIDs block the COX enzyme, fewer prostaglandins are produced. As prostaglandin levels decrease, pain, fever, and inflammation decrease as well. To understand NSAIDs, you need to remember there are two COX enzymes. COX-1 is the body's protector. It helps maintain the stomach lining, supports platelet function, and maintains blood flow to the kidneys. COX-2 is primarily active during inflammation. It converts arachidonic acid into prostaglandins that contribute to pain, inflammation, and fever. This distinction explains why there are two generations of NSAIDs. The first generation NSAIDs, like ibuprofen and naproxen, block both COX-1 and COX-2. Now that's good because they reduce pain and inflammation, but it's also why they can increase the risk of stomach irritation, ulcers, and gastrointestinal bleeding. They block the enzyme causing inflammation, but they also block the enzyme protecting the stomach. That's why you'll hear nurses remind patients to take NSAIDs with food. As nurses, we also assess for signs of gastrointestinal bleeding, things like black tarry stools, abdominal pain, or vomiting blood. Now with long-term therapy, we also monitor kidney function because prostaglandins help maintain blood flow to the kidneys. Now let's talk about our second generation NSAIDs, such as celecoxib, also known as Celebrex. These medications selectively block COX-2 while largely sparing COX-1. Because COX-1 continues protecting the stomach lining, these medications have a lower risk of gastrointestinal ulcers and bleeding than first-generation NSAIDs. However, there is a trade-off. Second-generation NSAIDs carry an increased risk of cardiovascular events, including myocardial infarction and even stroke. Another important nursing consideration is that celecoxib should be avoided in patients with a sulfa allergy since it is a sulfonamide medication. Next is aspirin, which belongs to the salicylate family. Like NSAIDs, aspirin inhibits prostaglandin production, reducing pain, fever, and inflammation. But aspirin has one very important difference. It permanently inhibits platelet aggregation. So in other words, it prevents platelets from sticking together for the life of the platelet. Now that means the increased risk of bleeding lasts for approximately 4 to 7 days after the last dose of aspirin was taken. This is why patients are often instructed to stop taking aspirin before surgery or invasive procedures. When administering aspirin, assess for signs of bleeding, educate patients to take it with food to reduce stomach irritation, and remind them to avoid combining aspirin with alcohol, other NSAIDs, or anticoagulants unless directed by their healthcare provider. Finally, let's discuss corticosteroids, such as prednisone. These medications are much more powerful than NSAIDs because they suppress the immune and inflammatory response at multiple points in the inflammatory pathway. They're commonly used for inflammatory conditions and are especially effective during acute flare-ups. But because they suppress the immune system, they also come with significant risks. Patients taking corticosteroids have an increased risk of infection. They may experience hyperglycemia, delayed wound healing, mood changes, weight gain, fluid retention, and adrenal suppression. One of the most important nursing considerations is this: never stop corticosteroids abruptly. When patients take corticosteroids for an extended period, the adrenal glands decrease their own cortisol production. Stopping the medication suddenly can lead to adrenal insufficiency, a potentially life-threatening condition which is characterized by severe hypotension, weakness, and shock. Instead, corticosteroids must be tapered gradually according to the provider's instructions. Other nursing considerations include administering prednisone in the morning, giving it with food to reduce gastrointestinal upset, and monitoring blood glucose, electrolytes, white blood cell count, and signs of infection. As you compare these medications, remember this important nursing mindset. Not every patient with inflammation needs medication. Inflammation is a normal part of healing. Our goal is not to eliminate inflammation completely. Our goal is to control excessive inflammation while still allowing the body to heal. Before giving any anti-inflammatory medication, ask yourself, what is causing the inflammation? What medication best addresses this patient's condition? What risks does this medication create? What assessments should I perform before and after administration? Those are the questions professional nurses ask every day. They move beyond memorizing medications and begin thinking critically about safe patient care. Remember, NSAIDs decrease prostaglandin production by blocking the COX enzyme. Aspirin also decreases prostaglandins, but uniquely causes permanent platelet inhibition, increasing bleeding risk for 4 to 7 days. Corticosteroids suppress the immune and inflammatory response, making them highly effective, but associated with more significant adverse effects. Knowing how these medications work helps you anticipate both their benefits and their potential complications. Every safe nursing decision begins with the right mindset. Keep developing your nursing mindset.